Hello and welcome to America in Crisis. I'm Olivia Olson with the USC Bedrosian Center, and I'm joined with Jody Armour, the Roy P. Crocker Professor of Law at the USC Gould School of Law. Jody, thank you so much for joining me.
It's good to be with you, Olivia.
So my first question is, what are you feeling right now?
Yeah, this has been a trying time in a lot of ways. I'm feeling distressed, sad, even a little pessimistic, because I know how many people are suffering, how many people have been separated from their jobs, their livelihood, oftentimes from communication with other people. Times like this, domestic violence rises because people don't have outlets, child abuse rises. So there are a lot of things that are making me feel more pessimistic. There's a sense in which nothing in the news but the blues on the one hand. But, on the other, I have two other kinds of reactions. One is that actually these feelings I have are nothing that new. I've been part of the Black Lives Matter movement. I've been a strong ally of theirs through the years and marched with them and been kettled by police with them. And I've seen the reality that they've been grappling with all this time has been a sobering one, and having to deal with those traumas day in, day out, that long procession of hashtags that's associated with Black Lives Matter, was not unlike what I'm feeling now. The experience of going through that period of time when it was at its height is still very much relevant, Black Lives Matter. You just don't hear about it as much. But, so I became accustomed to a kind of constant state of just distress and worry as a result of that. Also, people are talking now about not being able to wait until we can return to normal, normalcy. But normal before this time wasn't all that tolerable itself for lots of, socially marginalized people. And I'm going to focus again on Black folk and the Black Lives Matter movement. We've, in the Black community, normal has been a very desperate baseline to measure things by, right, in a lot of ways. And so, normal, I can remember in 2016, in November, up here in my home, I had my USC law students here on election night, waiting for the results and looking forward to a woman finally breaking that last glass ceiling in politics and making it into the presidency, and feeling very hopeful and thinking about this avowedly virulent misogynist was their view. Many people had that view of Donald Trump was going to be vanquished. And he'd also said a lot of things about Muslim registries and Black folks that were very racist, to be blunt. And so they were very hopeful and walked out that night, many of them in tears, right? And so that was normal, though. Those are normal times. And so when we have this nostalgia for returning to pre-COVID-19 times, to normalcy, it's not something I pine for from the standpoint of nostalgia. But I will just then say this one final thing. It's not all gloom and doom, because I also think at a moment like this, I have a little bit of hope in me that I hope becomes more than a little bit, a lot. It all depends on what we do with this moment, because this is more than, I think, just a moment. This may be not just an inconvenience, but an upheaval. We may be looking at a serious generational social upheaval. And we may have to look at things and approach things in a different way than we have hitherto. We more than ever now, people are starting to see the value of Medicare for all, for example. For a long time, before this crisis, people were talking about, well, you can keep your health care tied to your job. Well, when you're looking at 20, 30 million freshly unemployed people and the number's still rising, that doesn't look like such an attractive option anymore. Basic income, universal basic income, looks like something feasible, or at least a lot more humane and desirable from the standpoint of reducing the effects of a pandemic. And so I think that this may be an opportunity for revolutionary change, but it also could be retrenchment. It all depends on what we do with it. So I'm kind of hopeful too.
Well, speaking of what we can do with it, perhaps you've already touched on this, but other than healthcare, what is one policy area that we as a country must rethink as a result of this crisis?
Yeah, well, I think the policy area that we really have to rethink, and it's abundantly clear now, is how we approach criminal justice matters. Criminal justice reform has to be at the heart of how we're going to attack a pandemic like COVID-19, because we recognize that the epicenter of the coronavirus crisis is jails and prisons. That's where you have the highest concentration of a lot of these cases, and you don't have any opportunities for social distancing in those kinds of settings. They're kind of like cruise liners and nursing homes, only they're spread all over the country, and they're inescapable petri dishes for the spread of this lethal infection. And the only way, and those infections boomerang on the general society around the jails and prisons, because guards have to go in, correction personnel have to go into those prisons, and then they go home and they bring out whatever infections are in those prisons and jails into the surrounding communities. And if we're talking about jails alone, there's a churn in jails, people going in and out, every day, all the time. And so the virus is boomeranging on the community outside the cells and prison yards. And if we don't take care of those particular concentrated places where this virus is really raging and running rampant, where the health of the entire nation and the surrounding community is in peril. So I think that this is now becoming a lot more abundantly clear to people, and we're recognizing that public safety and public health includes and is especially focused on, should be especially focused on, what's happening in our jails and prisons.
Very interesting, absolutely. So what is a source of information that you trust in particular regarding the virus and governmental actions? It seems like as much as this is a really pressingly important issue, it's not widely covered in mainstream media. So what is a source that you've found to be abundantly sufficient in explaining this problem, and why do you trust this source?
Yeah, when it comes to journalism, good journalism, especially on criminal justice issues, too often the mainstream media, the oracles of the press that we most rely on for much of our information, have just served as stenographers in criminal matters for law enforcement, for police, for prosecutors, and other members of law enforcement. They haven't been critical in evaluating the claims of law enforcement. Law enforcement will tell them things like, a zero bail policy will create more crime or generate upticks in the crime rate, and they will just take that on faith, without inquiring more deeply into the bases for those kinds of claims. So wanting some outlet other than mere stenographers for law enforcement, I found that a publication called The Appeal, which is associated with the Justice Collaborative. The Appeal has really first-rate original journalism that reports on criminal justice matters and holds public officials to account in a way that I don't see happening and a lot of the other mainstream outlets. And so they are my one of my primary go-to sources for good, objective, balanced, fair information on criminal justice matters.
Excellent. Thank you. If you knew what you know now a year ago, what would you have done differently?
Yeah, if I knew a year ago what I know now, I wouldn't have done anything differently. In fact, I think I would have doubled, if not tripled down on what I was doing, which was writing about criminal justice reform and trying to get us to think about people that we lock in jails and prisons in a more humane way. My book that's getting ready to be published is titled Nigger Theory, Race, Language, Unequal Justice, and the Law. And the reason I use that blood-soaked epithet in my title, that N-word, is because no other word in the English language more otherizes individuals. And what we've done with our prison population and people caught up in the criminal justice system is otherize them, demonize them, monsterize them. And when we do that, we start thinking of them and treating them like just so much toxic human waste to be warehoused somewhere and forgotten, and oftentimes abused and mistreated. And the result is our abuse of them and mistreatment of them can again boomerang on us as a society outside those jail cells and prison walls because of things like the pandemic, the coronavirus pandemic, which has its epicenter in jails and prisons, comes back on us as a community because the infection rages through those places and returns to us. And so I would have continued to strive to encourage us, urge us as a society to think about those people with sympathetic understanding, empathize with them, try to identify with them, and not merely otherize them.
So what can we do now in the midst of this pandemic to mitigate the issues in our prisons right now? Is there anything we can do?
Absolutely. There's a lot that we can do and should be doing right now, and good journalistic sources like The Appeal have been, and the Justice Collaborative more generally, have been bringing these points home. We can depopulate our jails and prisons, first and foremost. That is, people we are detaining in pretrial detention in jails, who are waiting trial, who are presumed innocent, by the way, but don't have the money for bail. We can start to release them if they don't pose any risk of any kind of serious violence to the community. They need to be released. If they have the money, they would be released. People who do have money just put up their bail and walk out. The people we're keeping in are people we're only keeping in because they don't have the money to bail themselves out. Well, despite their presumption of innocence. So those people should be let out. People who are in jail for technical violations, like technical probation and parole violations, often are just rounded up and put back in the jails, even though they haven't done any kind of serious crime while they were out there, just technical violations. They should be let out. When we get to prisons, people who've been there and are older now, past 55, 60, 65, there's no reason to really keep them in. The recidivism rate among people when they get older drops precipitously. It plummets, right? So certainly people who have, served, some minimal amount of time and are a certain age should be let out. There are a lot of those kinds of, there's people in there for drug offenses, for, that really nonviolent drug offenses and even violent ones but they've been in there for a long period of time, 5, 10, 15 years, but especially people who are in there for drug offenses. There's no reason to continue to keep them in those situations. Let them out. That way, by depopulating, we could start to practice social distancing in the prisons. And the social distancing is how you prevent the contagion from spreading as rapidly as otherwise. So there are those kinds of concrete steps that we could take. We just need the political will and the moral understanding and moral commitment to do what's necessary.
So you mentioned the political will, and it seems like we have been surrounded by a lot of bad governance, but is there one leader who stands out to you as someone who's done exceptionally well during this pandemic, someone you think may spearhead or should spearhead this depopulation?
Yeah, I think that we have a rise of the progressive prosecutor over the last 5, 6, 7 years or so. And I used to think a progressive prosecutor was an oxymoron, right? I didn't think that a prosecutor could be truly progressive, look out for the well-being and welfare of the entire community, and not just single-mindedly focus on trying to lock people up for as long as possible on as many charges as possible. But you had people like Larry Krasner in Philadelphia, who received 75% in the general election of the vote, running on a platform of ending cash bail, addressing police misconduct, and ending mass incarceration. Rachel Rollins up in Boston, Marilyn Mosby in Baltimore. But for me right now, I would especially focus on, if I had to answer your question, I would say Chesa Boudin up in San Francisco. He has reduced the jail population as a prosecutor and has worked with other justice partners like public defenders, like sheriffs, and has worked to reduce the jail population in San Francisco and San Francisco County. I think now it's down to something like maybe 750, 780 people, something like that, a very low number, much less than when he came into office. And he's cut it, not only when he came into office did he start reducing the numbers in jail, but especially after the COVID-19 crisis erupted, he started reducing the number of people in jail. He's taken steps toward not putting people in jail because they were caught up in a pretext stop by police, where you just are pulling people over to shake them down, even though you don't have probable cause or even reasonable suspicion to think that they did anything, but you have a pretext, the tail lights out, you'll pull them over then and try to see if you can rummage around and find anything. He has said, don't bring those cases to me, those kinds of cases, those kinds of violations based on those kinds of violations of people's rights and using gang databases. He has just been very forward-thinking in redefining the role of the prosecutor. And while he's been doing all this, crime has continued to go down, right? So it's not necessarily a trade-off between safety and humane treatment. You can have both justice and safety and public welfare if we do things smartly, and I think he's showing the way.
Wow. Well, thank you so much, Jody, for your thoughtful answers. Look forward to reading your book. It comes out in August, you said?
August 18th.
August 18th. Well, save the date, everybody. And to all of our listeners out there, thank you so much for watching. Stay healthy and stay safe. Jody, thank you again for joining us.
Olivia, thank you. My pleasure.
Take care.